Welcome to the video on infection control, a critical component of specialized resident care and safety. Infection control involves several key practices, including hand hygiene, proper glove use, cleaning shared equipment, and following food safety procedures. Infection control matters because it protects residents, staff, and visitors. It helps prevent outbreaks, reduces hospitalizations, and meets regulatory requirements. Hand hygiene is the #1 prevention method. Always wash your hands before and after resident care and after bathroom use, handling body fluids or removing gloves. Personal protective equipment, or PPE, should be used when exposed to blood, body fluid, open wounds, or infections. PPE includes gloves and masks. Standard precautions mean treating all blood and body fluids as infectious. Wear gloves when necessary, avoid direct contact with body fluids, and always perform hand hygiene after care. For cleaning and disinfection, clean high-touch surfaces daily and disinfect shared equipment. Always follow product instructions and use only approved cleaning agents. The purpose of proper room cleaning and disinfection is to prevent the spread of infection. This should be done daily, after bodily fluid spills, between use, and after illness or isolation. The step-by-step process begins with hand hygiene, wearing PPE, and removing trash and soiled linen. Remember to always clean first, then disinfect. Clean from the inside to the outside, starting at the cleanest areas and moving toward the dirtier ones. Focus on high-touch surfaces like doorknobs and bedside tables. Always follow the contact time instructions on the disinfectant label. After cleaning, allow surfaces to air dry and then remove your PPE, finishing with hand hygiene. Key reminders include using only facility-approved disinfectants, never mixing chemicals, and documenting cleaning procedures per policy. For waste and laundry handling, dispose of waste properly and bag soiled linens. Do not shake dirty laundry, and wash with hot water when appropriate. If a resident is ill, report signs of infection immediately, such as fever or cough. Follow all isolation instructions and limit exposure to others. Staff responsibilities include reporting illness to a supervisor and staying home when sick. Follow all infection control policies and attend required training. Remember these key points. Hand hygiene saves lives. PPE protects everyone, and always clean, report, and document. When in doubt, report immediately. Now we will cover behavioral safety, which is essential for providing effective and compassionate care. Behavior is communication. We must identify triggers, use de-escalation techniques, and always follow established behavior support plans. Behavior is a way for residents to express needs, discomfort, emotions, or unmet supports, especially when verbal communication is limited. Every behavior has a reason. Common reasons behind behaviors include physical discomfort, emotional needs, communication challenges, environmental factors, and social needs. This slide is for illustration and review of the previous points. Staff should stay calm, ensure safety, and observe what happens before, during, and after the behavior. Follow the support plan and document any changes. Do not take behavior personally, ignore sudden changes, or use punishment. Behavior is communication. Understanding the message is key to effective support. Consider the scenario of Alex, who is usually cooperative but is now pacing, clenching his fists, and yelling. This is not typical for him. What should staff do? The correct staff response is to ensure safety first, stay calm, and observe to identify potential triggers. Use a calm voice, simple language, and offer choices to de-escalate. Continue by following the behavior support plan, supporting basic needs, and offering calming activities. Finally, document the behavior, triggers, and response, and report any change from baseline. The next section covers emergency response, detailing how to act when critical situations arise. You need to know when to call 911, maintain CPR and first aid awareness, stay calm, follow protocols, and notify your supervisor immediately. Call 911 immediately for any life-threatening emergency. Do not wait for approval to make the call. Call 911 for medical emergencies such as trouble breathing, chest pain, unconsciousness, seizures, stroke signs, severe bleeding, or a sudden change in condition. For safety emergencies, call 911 for fire or smoke, gas leaks, or situations involving violence or immediate danger. Remember, when in doubt, call 911. Always follow the dispatcher's instructions and notify your supervisor immediately after the call. Direct support professionals must maintain valid CPR and first aid certification, renewed every 2 years. If someone is unresponsive, call 911 first and only start CPR if trained. We will now review documentation and reporting, which are vital for continuity of care and regulatory compliance. Documentation must be accurate and objective, focusing only on facts. Complete incident reports promptly and according to facility policy. Follow the chain of command when reporting concerns. Protect confidentiality, following HIPAA guidelines by sharing client information only with authorized individuals. The next and final section covers general staff responsibility. It is your responsibility to follow care plans exactly as written. Deviating from the individualized plan can compromise resident safety and quality of care. If you are unsure about a task or instruction, ask questions. Clarifying ensures proper care and prevents mistakes. It is always safer to ask. Report any unusual behavior, change in condition, or safety risk immediately. Early reporting helps prevent accidents. Use the proper chain of command and document as required. Resident safety comes first. Always prioritize the well-being and protection of residents above all else. Ensure a safe environment, proper handling, and prompt response to emergencies. Resident safety is the foundation of all care decisions. We have reviewed safe transfers, feeding, medication safety, change of condition, vital signs, and body checks. We also covered Fatal 6 prevention, infection control, behavioral safety, emergency response, documentation, reporting, and staff responsibilities.
This concludes the video on specialized resident care and safety training. Thank you for your attention.